Hi guys, this is Dr. Anand Suresh from Department of Conservative Dentistry and Endodontics. So hope you guys are all fine and staying safe in this pandemic situation. So today's class we will be discussing about Rotary Endodontics. Okay, in this class I'm going to discuss about a little bit of material science and about the clinical techniques of how to use a pro taper system, because in market there are a lot of available different types of rotary systems. Okay, the most common rotary system we use is Pro Taper. So I'll be discussing about how to use that in clinical situation and how to use it in a sequence. Okay, moving on. So before proceeding into the material science, I would like to talk about classification of endodontic instruments. Okay, according to Grossman, it has been divided into four different parts. So the first part is exploring instruments, second is debriding instruments, the third is cleaning and shaping, and the fourth is obturating instruments. So coming to the first, exploring instruments, this is mainly used to locate the canal orifice and to determine the patency of the canal. Okay, example, endodontic explorers, smooth broachers or pathfinders. Next, coming to the debriding instruments, where after you do the access opening or after you locate the canal, it is mainly useful to extirpate the pulp and that of foreign debris inside. Okay, example, barb brooch. We usually use that to extirpate the pulp. And the third one is cleaning and shaping instruments, which is mainly used to clean and shape the root canal laterally and apically. You can either use a hand file system or a rotary file system. Okay. And next is the obturating instruments, where it is used to cement and pack the GP inside the root. Example, spreaders, pluggers, and dentalspirals. Okay. So moving on to the next, standardization of endodontic instruments. In olden days, they used to just manufacture the endodontic instruments of their wish, of how much ever. There is no standardization. So let's say there are 10 different manufacturers in the world. So each one will be having their own set of standards and guidelines to manufacture endodontic instruments. So that was very difficult because an instrument of one company rarely coincide with the comparable instruments of the other company, which was very difficult for the dentist to use at that time. So before 1958, endodontic instruments were manufactured without benefit of any established criteria. Okay, or it means there is no standardization or guidance. So then Engel came into picture and he gave a recommendation of how the instrument should be. So that's called standardization of endodontic instruments. This is the most common question they ask you in your exams. Okay, the standardization of endodontic instruments. So the Engels recommendation is the instrument should have a cutting blade 16 millimeter in length. Okay, only the cutting from the tip to the cutting part. And next, it should increase by 2% taper. Okay, every 1 mm it is 2% taper. It will increase, and the taper is constant. The diameter of the instruments at the tip is called D1 and is determined by the size of hundreds of millimeter. All right. And next is the diameter D2 is uniformly 0.32 mm greater than D1. So the length of the instruments available is 21, 25 and 31 millimeter. So basically they have the marking from D1 to D2. The D1 is the tip of your instruments, and D2 is where your working part of the instrument ends. All right, and the distance between your D1 and D2 is 16 millimeter. And the length available for your instruments sizes of 21 millimeter, 25 and 31 millimeter. It varies according to your different length of the canal. All right. And next, there is a modification of Engels' original recommendation, and there are basically two recommendations. So the first is additional measurement at D3. That is, they introduced after DO and D1, they introduced D3 where 3 millimeter from the tip. Okay, and then the specification for shapes of the tip is 75 plus or 15 degrees. These are the two specifications they have introduced. They might ask you this modification in your two mark questions or any part of your 5-mark question. Next comes to standardization of endodontic instruments. There are different ISO color coding, as you know by this time. So you'll be having 6 size, 8 size, 10 size like that, and it keeps on going till 140 size. All right. So the size 6 is usually pink in color, size 8 is gray, and 10 is purple in color. So it starts from 15. Usually these three we don't usually we use, because we use only when the canal is calcified or the canal is very very narrow. You use the 6, 8, 10. But usually we can start with a moderate size canal with the 15 size. So it starts like white, 15 is white, 20 is yellow, 25 is red, 30 is blue, green and black. So it goes like that. And after black, again it goes back to your white side, white color. Okay, it keeps on rotating like that. So these are the standard colors of your endodontic instruments. You need to remember this. Okay. And one more thing I want to mention is after 40, 45, 50, 55, 60, till 60, your instrument size will increase by 555. Okay. After 60, it is not 65. It is 70. After 60, your endodontic instrument, your file will increase from 60 to 70, 70 to 80, 90, 100, like that. Okay. Please remember that. So next is, what is the purpose of your cleaning and shaping? Your endodontic instrument comes into role during your cleaning and shaping, isn't it? So what is the role of your cleaning and shaping? Is to provide a biological environment that is conducive to healing. So you clean properly, you disinfect the canal so that it helps to eliminate the microorganisms and help the patient or the host to recover from the bacterial infection or any periapical lesion, let's say. And then to provide a canal shape that is comfortable to sealing. Okay, you increase the canal length, or you increase the canal shape, so that it is easy to obturate, or it is easy for the filling. So understanding the ramification of file and technique design relative to canal anatomy enables the dentist to consistently achieve the most excellent treatment with the least risks. So you need to know about the technique, how you use the rotary instrument, and what is the ramification of the file. All right, what are the file consist of, what is the sequence of the file. All right. So next is this is the basic component features of rotary canal root canal instruments. So the first one, from the tip to the end of the shank, is your working section. All right, from the tip to end of the shank. And then your working section consists of a cutting part and your non-cutting part. And next to that, it called as a shank. So that is the attachment section. So this is used to attach inside your handpiece, okay, rotary handpiece. And then there are some identification lines there. Okay, for example, if you use a Gates-Glidden drills, you have the identification lines is 1 to 6. So 1 is the smallest and 6 is the largest. So that will help you to identify the size of the instrument. And next you have a groove on the flat, which will help you to go lock inside your rotary handpiece. All right. So next is the material science. Material science is usually the endodontic materials are made up of these three different types of materials. The first one is carbon steel. The second one is stainless steel, and the third one is your nickel titanium alloys. The first, carbon steel. These alloys contain less than 2.1% of carbon. And next is stainless steel. These are corrosion resistance instruments. Okay, it simply means that it won't corrode easily, and they contain 80% chromium, 8 to 10% nickel, and 0.12% carbon. Next is the nickel titanium. They called as nitype. So these instruments contain 55% nickel and 45% titanium. Usually all the rotary like ProTaper and all the other ProTaper Next and Race and your Highflex and all those rotary files are made up of nickel titanium. Next, the advantages of carbon steel. Okay, higher hardness than the stainless steel instrument. So what will happen if there is a higher hardness? The flexibility is lost. Okay, so the disadvantage is the flexibility. There won't be any flexibility because it is rigid and it's prone to corrosion. Okay, so cannot be autoclaved and prone to rust. So next is the stainless steel. So stainless steel is corrosion resistance, as we already talked about, and disadvantages is stiff in nature. Is also stiff in nature when compared to night-time instruments or alloys, and prone to fracture and prone to distortion. Next is your nickel titanium, and all your rotary instruments are now mostly made up of nickel titanium, because the advantages include your shape memory alloy. Shape memory in the sense, okay, if the canal is curved, you introduce a ProTaper file inside, so it takes up the curved canal, and then when you remove the file from inside the canal, it automatically go back to its shape. Okay, that's called shape memory, so it retains back its own shape. So next is your super elasticity. Yes, in case of a curved canal, again the same example, it curves, and then it has an elasticity to adapt to the curved canal. Next is low modulus of elasticity, corrosion resistance is better than stainless steel, and softer than steel, good resiliency and biocompatibility. Alright, and the disadvantages is sometimes it has got poor cutting efficiency, and nitrile files do not show signs of fatigue before they fracture. Okay, that is why it is very important you do not directly use your endodontic like rotary files like ProTaper directly inside the canal. Okay, because it does not show any signs of fatigue unless same like your stainless steel. Okay, your stainless steel, it shows signs of fatigue. Okay, when it is used for 2-3 times, and then there is an unwinding of the file that shows the fatigue. Okay, there is a shiny part on the file, the K file. So that means it is time for you to discard that. If you still try to use the K file after it gets unwind, or if there is a shiny portion, when you use it again, it is prone to break in that particular area. Okay, so these are the signs of fatigue. So your pro taper and other files do not show that. So that is why we always recommend to use a 15 size or a 10 size file first, negotiate the canal, and then proceed with your pro taper systems. And then poor resistant to fracture as compared to stainless steel, as I mentioned. Moving on. And next, the property of night tie is, as I mentioned, is shape memory. So it can take up the shape and super elastic. These are the two main advantages we shifted to from stainless steel to night tie. And its unique ability to negotiate curvatures during continuous rotation without undergoing permanent plastic deformation. And this one I'm not going to cover much, because since you need to know about martensitic phase and austenite phase. Okay, so I'm not there are not much of questions here, but anyways, I would suggest you to go through this. Okay, if you have any doubt, you can always have a discussion in the discussion comment. Okay, not much questions will be asked from this, so I'm just not going to uh, spend time on this. So we're moving on to the rotary. Why rotary? Because improved safety and consistency of result, improved efficiency, and improved procedural simplicity. All right, these are the advantages of rotary. So next, come to your macroscopic image of the rotary files. Okay, first is you can okay, this is where this is the cutting edge. I don't know whether you can see this or not. Okay, this is the cutting edge. Okay, this is the main cutting edge of your ProTaper instruments. Okay, and then the other one, this is also the cutting edge. Okay, and this is also the cutting edge. Okay, these two, when the instrument rotates, these two will cut. Okay, there is something called as a rake angle or a cutting edge angle. Okay, so the rake angle is nothing but at your level, at your undergraduation level, what you need to understand is the positive rake angle cuts. Okay, the negative rake angle just scrapes, it does not cut. Okay, as of now, you just remember the positive rake angle cuts. Okay, the instruments which is having a positive rake angle cuts. All right, cuts the root dentin inside when it rotates. Okay, as I mentioned, these two are your cutting edge, and in between these two cutting edge, this one is called as your land. So these are the names they have kept it. So don't get confused or intimidated by this. So just names. So and next is your helical angle. Helical angle is nothing but this is the cutting blade angle, and when you draw a line perpendicular to the instrument like this, and when you measure this angle, it is called as a helical angle. All right. And then in between your, this is one cutting edge, and this is one cutting edge. Okay, in between this part is your flute. Okay, this part is called as your flute, where the instrument rotates inside the canal and the debris collects in here. This is the depression. Okay, so the debris will collect here, and it's not going to go beyond the apex, so that the debris is going to collect within the instrument, so that you can take out the instrument and clean it and then reuse it again. Okay, this is the advantage of it. So that's it. Again, I don't want to talk much about this and then confuse you. Our main aim is to just know the instruments, material science and the technique, and then you have to use it in a good way in the clinical side. Okay, like I'll be explaining in some slides. Okay, fine. So next is your active tip. The instruments will always have an active tip and a passive tip. Passive tip, as you all know, passive tip does not cut, whereas your active tip cuts and goes inside the dentin. Right? And next, the golden rule. Yeah, the golden rule for night eye rotary preparation. The golden rule here is assess the case difficulty. Okay, you just assess before the pre-op whether you have a straight canal or a curved canal or a S-shaped canal or a C-shaped canal and everything. Whatever the pre-operative X-rays or a CBCT, anything, you take it and then confirm it. And then next is provide adequate access and prepare with hand files up to size 20 prior to rotary use. That is, this is a very important step. You cannot, since the rotary instruments will not show the fatigue, so it is always important to use a K file or a stainless steel file. The K file, you enlarge the canal first to 10, 15 or 20, and then you go ahead with your rotary file and use light touch and low RPM. Okay, proceed with ground down sequence and replace rotary instruments frequently. No instrument is, you can use it for lifelong. Okay, all instruments will have its own time period to just discard it. Okay, usually the manufacturer advice for rotary instrument like pro taper is only single use. Okay, so, but some people are using for 3 to 4 times. But if you are using that, but make sure you check and you note down how number of use. Okay, ideally it should be only one single use. Okay, so, and one more thing I want to tell about usage of rotary instrument is, usually when you use a stainless steel K file, you can reach your working length, okay, till the working length, and then you can file it. Okay, when you use a rotary instruments, once you touch your working length, your cleaning and shaping is done, and no need to go like 5 times, 6 times, 10 times, not necessary. Once you touch the working length, you can change it to your next sequence. All right, this reduces the fatigue of the instrument. And next, these are the available pro taper system in the world. Like these are there are a lot of pro taper systems, and the most commonly used, what we use is pro taper. Okay, pro taper next, pro taper gold, and recently there are a lot of single file systems is available. Okay, so it's up to you to which one you are comfortable. You can always use, but in this presentation I'm going to explain about pro taper system. So the pro taper file was introduced by Dr. Cliff Riddle, Dr. John West, and Ben John, and Dr. Peary. And what does pro taper means? Pro taper, as the name suggests, it is called as a progressive taper. Okay, usually the taper is uniform for a K file, like 2%. Okay, for a K file you take 15-20 size. The taper is 2% taper, whereas your pro taper will have a progressive taper. Each and every segment has a different pro taper system. Okay, so why it has got a progressive taper, we'll be discussing about that, and it is made up of night eye alloy. The change in percentage of taper over the length of the cutting blade, that is called as a progressive taper, is a unique feature here. Okay, the progressively tapered design improves flexibility, cutting efficiency, and the safety of these files, because each and every taper will have a contact with the specific root canal wall, so that not all your file is simply touching a root canal while it's in rotation. All right, a specific point touches there, so that it reduces your instrument fatigue, your breakage. Next is a cross section, convex triangular, decreases friction between blades of the canal wall, and it increases its cutting efficiency. Okay, and the tip, it has got a modified guiding tip. Okay, rounded, it does not have a cutting tip, rounded non-cutting, and parabolic shaped tip. Okay, these are the designs for the advantage of your cutting efficiency and better flow inside the canal, and loose debris into the intra-blade flutes, as I mentioned in your flutes. That is the space between your two cutting angle. Next, the variable tip diameters of ProTaper file allows it to have specific cutting action in defined areas of canal without stressing instruments in other sections. As I mentioned earlier, so the specific points that will be contact, so that all the instruments is not in continuous what to say continuous contact in all the surface. And next, it has active motion. It acts in active motion, increases efficiency, reduces torsional strain, and length to file handle. Okay, usually the K file, the handle is more, whereas your ProTaper hand file is the reduced from 15 to 12.5 millimeter, so that it is accessible in the posterior areas. Longer the handle or the longer the shank, it is difficult for you to reach the posterior molars. Okay, if it is the short, you can easily accessible. Then benefits of the design: increases flexibility. As we know, NITA instruments are will have a lot of flexibility, and each instrument produces its own crown down effect, as larger tapers make way for smaller tapers. And ProTaper files engage as a smaller area of dentin, reducing torsional loads and file fatigue. The same point. Okay, next, this is the same slide which it explains about nickel titanium advantages, like it has got 55% nickel and 45% titanium. Advantages is shape memory, super elastic, softer, compatibility, etc. And disadvantages is poor cutting efficiency, poor resistance to fracture as compared to stainless steel, which we have already mentioned. Okay, next is your crown down technique. So this ProTaper system will use your crown down technique, where you have to use a larger taper files first, and then you use larger taper in the coronal part, and then you go inside your apical part by using a smaller taper. So the crown down technique is coronoapical technique, where you start from the crown and end in the apical region. And it starts with largest instruments introduced recently. It shapes coronal 1/3 initially. Alright. And then commonly used files are your rotary files. Okay, next, come to the clinical side, where the clinical technique I'll be explaining about how to use the ProTaper file. So ProTaper system consists of just 3 shaping and 5 finishing files. Okay, it has got 3 shaping files. That is, the shaping files will start with the letter S, and your finishing files with F. So we have SX, S1, S2. So these 3 are shaping files, and F1, F2, F3, F4, F5 is your finishing files. Alright, the first file is your SX. There is no identification ring on the handle, shorter in length when compared to the other files, that is S1, S2, F1, F2. They are like 21 mm and 25 mm also. So this is actually shorter than it, because it is only 19 millimeter. And DO, the tip diameter, is 0.19. D14 is 1.20. There is increase in taper up to D9, and then drops off up to D14, which increases its flexibility. Okay, this is mainly used for shaping of the orifice. Okay, before, when you do how to say, access opening for the anteriors, or yeah, you can say access opening for the anteriors, you are being advised to use a gauge screed and drills to enlarge the coronal orifice. Okay, the same thing applies here. Okay, SX system works the same principle. It is used to enlarge the orifice. Next is your S1, and it is purple in color, purple identification ring on its handle. And DO, the tip diameter is 0.17, and D14 is 1.20, used to prepare coronal part of the root. Same like S1, coronal part. Mainly it focuses on your coronal part preparation. And next is your S2. S2, white identification ring on its handle. The tip diameter is 0.20, and D14 is 1.20, used to prepare middle third of the canal. Okay, SX and S1 shaping files is used to enlarge the crown portion, that is the coronal portion, and this S2 is used to enlarge your middle third of the canal. So when you see your S6, S1, S2, S6 and S1 coronal, S2 is middle third. So it divides, the file divides your cleaning areas. So this will cause less fatigue to the file and it will cause less breakage. So it was designed in a such a way. And next, when you come to F1, is called finishing file. This finishing file is used to prepare your apical third of the canal. See, it has been divided into three parts. So the tip diameter yellow, this is yellow in identification, and DO, an apical taper is 20 and 0.07. And red, the tip diameter is 25 and 0.25, 0.08 in taper, used to prepare apical third of the canal. F3, blue in color, tip diameter is 30. You can always correspond this blue color. F3 corresponds to your K file 30. Okay, the K file 30, the tip diameter is the same corresponding to F3. The tip diameter of F3 and K file 30 is the same. Okay, the same like F2, the tip diameter of your 20 size K file and F2 is the same. Alright, and this is used to prepare the apical third of the canal. And F4, the tip diameter is 40, same like your 40K file. Okay, you can correspond for easy remembrance. And black colored ring on handle, taper is 6% for this. And this is used to prepare apical 1/3 of the canal. Alright, from F1 to F5, it is simply used to prepare your apical 1/3 of the canal. F5, again, your tip diameter is 50 here. DO diameter is 50, same corresponds to your 50K file. 50K file, your tip diameter is 50. Okay. Okay. Next, the taper is 5% here and used to prepare the apical third of the canal. Usually, you stop your cleaning and shaping, that is still finishing file F2, that is the red color, red code. And if the canal is wide, you can still go up to F5. Usually for anteriors, they will use F till F5. Usually for premolars and molars, they stop till F2. Okay, and for upper molars and your lower molar, upper molar palatal, lower molar distal, sometimes if the canal is wide, you can go up to F3. Okay, so these are the systems you use. And the next we talk about retreatment files. Okay, we talk about a retreatment where there is you have filled the root canal and there is a short of apex, or a patient comes to you from a different clinic where the obturation is not done properly, so you are planning to do a root canal treatment. So the normal conventional method which we follow is use of your H file and your xylene, that is your solvent, GP solvent, and then you try to remove it, whereas that is little time consuming. So when you use a rotary file like this, a ProTaper system has got retreatment files from D1, D2, D3. Alright, a D1 is used to remove filling from your coronal third, same like your other ProTaper system. They have divided these three into removing each and every part, like coronal, middle third, and apical third. And it is short file, that is 11 mm handle and 16 mm cutting surface, and white ring for identification, ISO 30, activity for easier penetration of obturation material, and 9% taper file. Taper is more. Next is your D2, which removes the filling from your middle third, 11 mm handle, 18 mm cutting blades, two white rings for identification. Okay, in the handle, if you see D1, there will be one ring, and D2, there will be two rings. And ISO 25, non-active rounded tip. When you see D1, only D1 is your active cutting tip. Active cutting tip in the sense it pierces the filling and goes inside. Whereas your D2 is non-active rounded tip to follow the canal path. Alright. And 8% taper file. And D3 removes filling from apical third, 11 mm handle and 22 mm cutting blades, and three white rings for identification, ISO 20, non-active rounded tip, and 7% taper. Okay, see, when you see the full ProTaper system, you have 4% taper, 2%, 6% taper, 9% taper, 8%, 7%. So the taper keep on differs. So that's why they call it as a progressive taper. Okay, and this is for hand use. Okay, this is the hand ProTaper. So usually for the hand ProTaper and for the rotary, the sequence does not usually change much. And the difference only here is it is up to you to use your SX first and S1 first. It's up to you. Okay, usually after the access opening, the first step is you negotiate the canal, or it's called a pathfinders. Okay, so you use a 10 size file or a 15 size file. All right, you just negotiate the canal, just locate the canal, negotiate it, and then you can use an S1 shaping file. Okay, shaping file till the working length, and then you can use an SX. SX is only used to enlarge the coronal orifice, as you always use GG drills, that is glade cradle drills. It is optional. All right, and then after that, after you use S1, okay, and then you can negotiate again with 10 size and 15 size to make the patency confirmation, and then you can determine the working length, and then proceed with again S1, S2, F1, F2, F3. So the sequence continues as follows. All right, so now I can show you. Okay, clinical procedure. So how to do it? Explore the canal with 10 size after you do the access opening. Okay, let me start with this. A patient comes to you with a pain, severe pain on lower molar, first molar. So you have decided to start a root canal treatment. So first step is you have to give LA. Okay, LA, and then rubber dam. Isolation is important. Rubber dam, and then you start your root canal treatment. The first step is remove the decay, and then you do the access opening, locate the canal. All right, this steps is common for all the procedures, all the procedures, like whether you use a rotary or a hand file. This is the common step. Okay, the first you need to explore the canal with a 10 size hand file. Since it is a molar, the canal will be little narrow, so use a 10 size hand file to explore the canal, and then you remove it and negotiate with 15 size, the next file size. After that, after using 15 size, you can use a coronal flaring, that is with your shaping file. Insert file with slight apical pressure until resistance. Okay, you just have to use it in clockwise and anti-clockwise direction. You cannot simply screw any file inside the root canal because it tends to fracture. Okay, you should always progress your files inside the canal by either turning clockwise and anti-clockwise. Okay, you have to follow clockwise, anti-clockwise, clockwise, anti-clockwise, and then you push the file little bit and not giving a lot of pressure also. Okay, you just have to follow this technique to go inside the canal, withdraw, and then clean. Okay, this is a very important step. Okay, the first is the canal, then use S1. Okay, S1 is used. You can use till the working length, insert with slight apical pressure until resistance. All right, and then you turn it counterclockwise to half clockwise, clockwise, anti-clockwise, clockwise, anti-clockwise. You can reach till the working length. Okay, same technique, withdraw, clean the file, and then once you have done it, coronal flaring with SX. This is actually optional. You can use this or you can use a GG drills. Okay, so once you use the SX, your dentin shelf or the lingual shoulder is, you can just break it so that your file is straight. It's called straight line axis. And then after that, you um, determine the working length. Okay, you keep a 15 size file and determine the working length. Okay, then you use again S1 till the working length. Okay, before you use the S1 till your tentative working length. And now after determination with your 15 size K file, after you using SX and breaking the lingual shoulder and the dentin shelf, you just going to measure your working length and use S1 till the working length. And then after S1, your coronal portion is enlarged. Okay, now we are moving to your middle part. So next is your middle third preparation with S2. Okay, after this you need to use your file till your working length. Okay, S2 use till the working length in the same motion, clockwise and anti-clockwise. Okay, and then S1, S2 to working length. Then after that, after S1, S2, you proceed with F1. F1 is mainly, as we discussed, F1 is used for apical preparation. SX, S1 for coronal preparation. Okay, S2 for middle third, F1, F2, F3, F4, F5, all files are for apical preparation. So F1 now you are using till the working length for apical preparation. Okay, till the, okay, once you can use F1 and F2. All right, F2 is your red color, which corresponds to your 25K file. So once you decided to stop your cleaning and shaping, okay, once you finish your F2, okay, F1, F2, F2 is red, okay. So once you decided to stop in red, you remove the ProTaper file, okay. After that, you take a 25 size K file and then you have to reach the working length to gauge, okay. You need to remove the small debris and then you need to gauge and then you need to irrigate and remove all the debris, all right. And then you can proceed with obturation. So this is the important step where you use a small size file. The taper is the 25K file, the taper is 2%. So you are going to use that as an idea of recapitulation. Use of smaller size files to loosen the debris, okay, and then file it slightly and then you irrigate it and then remove it. For larger canals, as I mentioned earlier, continue your apical preparation with F3, okay, and F4 and F5, okay, till your working length. If you want to stop it in blue color, that is your F3, again gauge it with 30 size corresponding K file. If you want to stop it with F4, again gauge it with 40 K file. If you're going to stop with F5, gauge it with 50 K file. All right. Okay, this is the glide path. The first one is a glide path usage. How this is the sequential steps of how your canal is being increased with the ProTaper system. The first one is a glide path. That is your 10 size file or 15 size file or separate glide path pathfinder files. The next is your S1. When you say S1, only the coronal portion is increased. Okay, when you see here, only the coronal portion is increased. Okay, so that is S1. And S2, your middle portion is increased. As we mentioned, S1, S2. Okay, middle portion. This is middle third. F1 is your apical third. All right, apical. This one is apical, so this one is apical. So this progressive taper is always helpful for the files to reduce the fatigue, as I mentioned before also. So this is the idea behind your ProTaper system. And next other system, there are a lot of system, ProTaper Gold, ProTaper Next, Wave 1 Gold and everything from Dentsply. So there are slight differences, not much differences. The taper, slight taper difference and the shortage of handle, the shorter the handle, 11 mm only. So there are some modifications in that, but all the system, the technique is all the same. Okay, ProTaper nickel titanium rotary files substantially simplify root canal preparation and particularly in curved and restricted canals. Yes, this is very useful. Rotary system is very useful in case of a curved canal where your stainless steel flexibility is less. Okay, the stainless steel flexibility is less. Even though you pre-curve the file and then you do the cleaning and shaping, there is high chance for a zipping or perforation or all other perforations, uh, all other problems. So in order to avoid that, the rotary system, the flexibility is more and it easily adapts to your curved canal and restricted canals, and it's automatically takes up the original shape when it is outside the canal. So these are the advantages and elasticity of the material. So these are the advantages. And your time consumption when you do with manual file when compared to rotary is much faster in rotary. And the guidelines is frequently clean and inspect files after use. This guidelines is for all files, irrespective of your rotary or a hand file or a stainless steel or K file. Use only in well irrigated canals, okay, and never force instruments and determine exact working length. Recommended speed is 150 to 350 RPM. RPM is rotation per minute, so you should not exceed the speed, okay. So these are the guidelines. So once you finish your cleaning and shaping with the rotary instrument like ProTaper system, so where you're stopping, like if say you're stopping at F2, let's say this is F2, right? This is the F2. Okay, you're stopping in F2. Your last file used was F2. So you can take a corresponding paper point first. Dry the canal. This is the corresponding size paper point. Dry the canal. Okay, and then you can select this corresponding GP coat the sealer and then place it. Okay, so you don't use, like, you use the file F2, and if you use F3 it will be short, or if you use F2 and you use the F1 pro taper, it might go beyond the apex, or it won't fit properly, the stuck fit won't be there. Okay, always the corresponding last file which you use, take the corresponding GP and then obturate it. The conclusion would be, from a biological perspective, root canal treatment is directed towards elimination of the microorganisms from the root canal system and prevention of reinfection. Okay, before they used to call this as cleaning and shaping. All right, you clean, okay, and then you shape. Okay, now the concept has been changed to shaping and cleaning. You shape the canal first, remove everything, and then cleaning, in the sense disinfect the canal, because once you disinfect the canal, you kill the microorganisms, the success rate is going to be more. All right, technical advances in the form of rotary nitre instruments have led to dramatic improvements in the ability to shape root canals with potentially fewer procedural complications. Right, so that is why we have been shifted to rotary instruments and nitre instruments. But only thing is, you need to know how to, the precautions of how not to do, and what is the technique you use to follow, and what materials you need to choose for a particular curved canal or something. Okay, so this, and yeah, the same retreatment files which I have mentioned, D1, D2 and D3, same thing.